Good morning, everybody. Thank you all for joining us, and I'm delighted to see the room so full this morning. And if everybody could just take a seat, we're going to kick off our talk this morning. Is everybody sitting? Yes. Okay, great. Well, you're all very welcome here this morning. It's a very early start to an exciting day. I'm sure you're all very busy, but I'm delighted that you've taken time out of your schedules to join us here this morning. My name is Lorraine Clifford-Lee. I'm a Senator from Ireland, and I'm Chair of the Interparliamentary Union's Health Advisory Group. So I'm delighted to be here moderating today's discussion. Excellencies, distinguished delegates, colleagues, very welcome, and thank you for joining us, as I've said. In my capacity as chair of the IPU Advisory Group, I'm also spearheading SRHR. The advisory group brings together committed parliamentarians, and we pay particular attention to groups and populations that are facing barriers and discrimination in accessing SRHR and essential health services. One of our initiatives this year is to open the space for dialogue on sensitive topics, and I'm delighted that today the IPU is launching a podcast series in which Pascale, who is one of our panelists here today, has participated. So I'd encourage you all to listen to this podcast on all available platforms. I'm glad, and I would like to thank the organisers for providing us with this platform today in the context of the World Health Assembly to continue promoting dialogue on SRHR. Over the next hour, we will hear how member states are championing evidence, experience and action to advance SRHR as central to health, rights and sustainability. And we will examine the challenges and opportunities that lie ahead to meaningfully realise SRHR for all. From access to contraception, fertility care, maternal and perinatal health, prevention and treatment of sexually transmitted infections, protection from sexual and gender-based violence, and education on safe and healthy relationships, sexual and reproductive health can be life-giving and life-affirming, interconnected and affecting us all. As a parliamentarian, I know that SRHR can be a hot topic in the media, social and political spheres, and it's not always easy to discuss these issues. I know we must find ways to do so because it is so essential. Recently, the World Health Organization and the Interparliamentary Union signed a new memorandum of understanding that explicitly emphasises the importance of reducing health inequalities, especially in relation to sexual and reproductive health and rights. I'm so pleased to moderate this session today as we learn better how we can work together to advance a forward-looking agenda through an exchange of evidence, experience, effective policy, robust legislation and action. To understand where we are going, we need to also look back from where we have come. 30 years ago, the International Conference on Population and Development underscored the right of all individuals to achieve the highest standard of sexual and reproductive health and rights. In 2004, the WHO published a reproductive health strategy ratified by 191 member states at the 57th World Health Assembly, and that reinforced the centrality of SRHR to societies and to economies. These frameworks are grounded in gender equality and recognising the unchanging importance of sexual health in achieving health for all. But the world around us is changing. Amid interlinking global crises, protecting and promoting comprehensive SRHR across the life course plays a crucial role in building population resilience at individual, community, subnational and national levels. By examining trends, uncertainties and innovations, we can proactively strategise to uphold rights, advance equality and promote equitable access across a person's lifetime, and I think that's what we're all committed to. So I'm really excited to introduce my guests here today. We have Secretary Becerra, we have Minister Daba, and Deputy Minister Senesi. I hope I've pronounced that correct. Senesi. and thank you very much for joining us, and I know the three of you are very busy. So I would like to invite Secretary Becerra first to give his opening remarks. Thank you.
Senator Clifford Lee, thank you very much. I'm honored to be with our panelists today, ministers, and also to say to each and every one of you, it is a thrill to be with people who are championing this cause. I'm going to diverge from what my team wanted me to focus on a bit because I sense this energy. I don't know if it's because you are jet lagged, but there was at 7:15, you all were already buzzing, which is a really great sign that you're here for action. And I hope that's the case because the assaults that we are seeing on humanity are in need of desperate action and a lot of buzz. And no one can take for granted where this new world is taking us. And I think it's so important that we take this on. A poet who didn't get to live, in fact, Irish poet, Dylan Thomas, wrote a... Oh, Welsh. I'm sorry, Welsh. Oh. Leave it to the Irish to correct me on that one. But yeah, he was Welsh. You're right. He was Welsh. Yeah, but he wrote this poem that he never titled, but I love because I explain what he said in a different way, and I'll tell you the way I learned to explain it. He wrote a poem which starts, "Do not go gentle into that good night." Well, that's one of the refrains. "Rage, rage against the dying of the light." If there's nothing I say that you remember, I hope it is just one thing. Do not go gentle into that good night. Rage, rage against the dying of the light. Be fierce if you believe in what you are here to do. If your cause is just, you cannot let any moment of sunlight be lost. I say that in one word, ganas, G-A-N-A-S. And I always tell folks, if you look it up in the dictionary, it's a Spanish word, it will never capture everything that I learned is behind ganas. Because ganas contains desire. If you look it up and you Googled it real fast, it probably would say desire. It's guts, grit, and game, all in one. And I remember my parents saying to me, "Tienes que tener ganas." You have to have ganas if you're going to really achieve something. And I think Dylan Thomas was, and the talk is that he was writing this poem about his dad, who was having a difficult time in his later years, and he was essentially saying, "Dad, don't go. Fight this. You know, you suck every minute of life before you leave." And I think it's so important for us at this moment to recognize that we must extract every ounce of energy from the air, because otherwise someone else will take it from us and do something with it. And so it should not surprise you that in the United States of America, under President Biden's leadership, we are now before the Supreme Court fighting with ganas to protect a woman's right to access medication abortion, all the way to the Supreme Court. We'll find out in the next month what happens. It should not surprise you that we've gone all the way to the Supreme Court to protect Americans' access to emergency care services they need, including abortion, when their life or health stability is at risk. It should not surprise you that we put out a regulatory rule recently which says that your private information on healthcare cannot be disclosed, whether you are patient or you are provider. Because today, providers are being threatened with criminal action in the United States of America if they don't reveal what they've done with regard to the healthcare, reproductive healthcare of individuals in the United States. It should not surprise you that under this administration, we have gone from providing access to maternal health care for a woman who is poor from 60 days to 365 days a year under our Medicaid program. And that perhaps doesn't sound like a great deal, except if you recognize it in America, even though President Biden has set records in the number of people who have health insurance coverage. Never before had we seen more than 300 million Americans have access to health care because they have their own insurance. But because 60 days was the only amount of care we would give to a mother and her baby after birth. And we know that it's during that time after birth when so many of the terrible outcomes, maternal mortality, occur for so many women after birth. So to have postpartum care run now 365 days is a big deal in the United States of America. It should surprise no one that we have also now issued a regulation which makes clear that discrimination now includes someone who is trying to get access to healthcare services that could include reproductive healthcare services. Because at some quarters of our country, it was not recognized as being protected. And so we're going to continue to push. But it is awkward for me to be here standing saying, we could learn a lot from you around the world, because today America is behind when it comes to protecting reproductive rights and sexual rights. So the push that we see for sexual and reproductive health and rights is one that this administration is championing. And I know we'll champion again if given a second term. But we cannot go gentle into that good night. Come November, we're going to rage against the dying of the light. Because if we don't demonstrate that ganas, the lives and health of a lot of people will be at stake. So I am thrilled to be here on behalf of the Biden administration, because we have lots of work to do, but I felt the buzz and I feel good. So thank you.
Thank you very much for your remarks and very wise words. And us in Ireland, we have recently gained a lot and made huge progress in relation to SRHR, but the example of the United States shows that you can't take progress for granted, and you have to always be updating the battle, because the battle will attack you on a number of different new fronts. So thank you very much for the work you're doing, and we're all watching it very, very closely. It gives me great honour now to introduce Her Excellency Dr. Mekdes Daba, the Minister of Health in the Federal Democratic Republic of Ethiopia. Thank you.
Good morning again. It's very inspiring to hear that everyone in here is at the same room by 7:30 in the morning. I can imagine how some of you have already just flew in yesterday with a jet lag, and some have just been having the long days yesterday with our meeting starting, with WHO starting earlier, and some of you have even done the walk the talk. So I think we are in this stage that we wanted to do walking the talk. So it's a great pleasure and an honor to be with you, Excellencies, my colleagues, my former colleagues, and it's an honor plus an emotional stage that I'm sitting today to be on this side and still talking about the topic which is very dear to my heart. So if you look at the topic, I mean, the title even saying empowering tomorrow, how do we make sure that we empower tomorrow? We seize the opportunities we have, and we make sure that voices are heard. And we take lessons from what we have achieved so far, but don't take it for granted. So looking at what Ethiopia has achieved over the past few years, especially over the past few decades, it is really impressive for someone who has lived in Ethiopia, who has a mom who has 6 kids, and who has a grandma who has more than 10 kids. And I'm a mom now who have 2 kids. So it's about choice. It's about empowering. It's about giving an opportunity for people to decide on what they can do and what they want to do. So what Ethiopia has done over the past few years and couple of years, you can just look at a generation who's living. A generation like me, who's a mom, who had an opportunity to go into medical school while most of the population didn't have an opportunity. And then if people have an opportunity to get to school, to learn, to have an information, so information empowering has a greater potential to have people to decide on getting the right information. So the right information to empower on decision can be demonstrated if you look at a generation like ours. So I really want to take this opportunity to say that Ethiopia has done a tremendous job in empowering others and giving an opportunity for women and girls. Women and girls to seize an opportunity to lead. My predecessor, Dr. Leah, is a former Minister of Health who was an OBGYN. I'm also an OBGYN by training and a family planning subspecialist. And you can see that giving an opportunity and listening to women and girls is part of empowering and giving an opportunity to seize the future. So if I don't take for granted on what has happened, but if you look at the unmet need for family planning in our country, we have still the highest unmet need for family planning. But it's still much better than what we had a few years back. We have 22% unmet need for family planning. The maternal mortality rate in our country, not only in our country, but in the region in Africa is still higher. We're still struggling behind. So 267 per 100,000 live births. So we're talking about life. We're talking about decision making. And the other thing that we have to see is neonatal mortality. We're still having the highest one. So what we talk about the spectrum of SRH is from empowering, but also saving lives. It's about giving decision-making power to women and girls and families so that they can decide on how to save their kids, how they can decide on their family, and what type of family they can and they want to have. So as a result of what has been done by the country, we have seen that the work and skilled health manpower, the skilled health workforce is at the center of it. We still have highest disparities between urban and rural because Ethiopia is very vast. As you know, we have the second largest population in the region, and it's not easy. By the way, it's still I'm still on my 100 days, and I had an opportunity to meet with some of you when I took office. So it's very important to listen to the community. And the community's voice and the voice of the community as the center of decision making can help us in empowering the future and ensuring that we address their need. So if you look the disparities in urban and rural and lowland and highland regions of Ethiopia, you can see Addis, which is the capital, have another form of unmet or met need. And you would see skilled birth attendance in general is now 15%. So when I was a medical student and when we were doing residency, it was around 10%. So we're talking about a country which takes pride in what we have achieved so far, slowly, but we don't stop. We have to still think ahead of time and think of the future. Because when we are talking about future, when we're talking about seizing opportunities, it is to ensure that we give voice to the young, voice to the youth. We ensure that gender-based violence is not going to continue. As a country which has been passing through several challenges, we just passed through COVID, all of us, as a globe. And then we had a change that we're still facing, like the climate change. And another one that we are already facing was COVID plus climate and then conflict. So the 3 Cs, if you want to see what are the impacts of the 3 Cs and what you have achieved can go back with some strides like this, just look at Ethiopia. So we are starting to see some challenge now, which we have already achieved initially as a greater achievement over the past few years are starting to be challenged again. So we have to have an opportunity to see things from the different perspective now that the world is changing. We have to admit that we're not in the same world as we were before. So we have to see a future in a different lens, taking a lesson we had from COVID when essential services were disrupted in most corners of the country, and then we stepped up. By the way, civil CSOs were giving voice, and professional societies were also giving voice to the ministry, and the Ministry of Health had given their ear. And the government also was really dedicated to give an ear and say essential services like family planning and services for maternal, in general SRH services can never be disrupted during COVID or climate change. Climate change, we're still living under it, so I can't say that we have achieved everything. But at least during conflict and the COVID time, we made sure that essential services and clinics, outpatient services, abortion services were not disrupted, and the services have continued. So it takes leadership. It takes a gut to say that this has to be done. And we're listening to voices from civil CSOs is very important, and giving them an opportunity, but working in a comprehensive way so that we are aligned and we have strategies in place, and the strategies should not be changed when leaderships are changing. We have, I would say we are very lucky in Ethiopia because my former predecessor had a similar stand. We have similar stand of ensuring that young generation has an access to all SRH services. Thank you very much.
Thank you very much, Minister, for your remarks. And I was really struck by your comments there around the choice. And I often think back of my own grandmothers, and they had no choice in their reproductive choices at all. They had no choice. Both my parents came from families of 9 children, which was very common in Ireland back then. In fact, 9 children was quite small as a family. There was 12, 13, 14. A lot of women died, suffered bad health consequences. Babies died. It was very common, and poverty was common. And it was only when women began to get choice around their reproductive health that we began to prosper as a country. And I'm often thankful for my own choices in my own life, and the choices that even my own mother didn't have. So to see that you're championing choice for women in Ethiopia is very, very good, and thank you for your work. And now it gives me great honour to introduce our next speaker, Deputy Minister Senezi. He is the Deputy Minister for Health and Sanitation in Sierra Leone. Thank you, Minister.
Thank you very much, Madam Moderator, and thanks to my colleague panelists. It's a special pleasure for us to be here from Sierra Leone, a little country in the west coast of Africa. And then when I looked at the topics, the sexual reproductive health, right, culture, and conflicts, I think Sierra Leone stood at a crossroad because we have gone through conflicts in the past years which mitigated on the rights of women, etc. But notwithstanding that, we'll be able to come out of this conflict, out of the pandemics, Ebola and COVID-19, and there's yet we're quite on top of a situation where they get on sexual reproductive health rights. And then we have a young population in Sierra Leone and Africa, or low and middle income countries. Our average age is 19 years, which means when it comes to sexual reproductive health rights, we've got a younger population. And then we promote a lot of contraceptive use among our population, especially ones like condom. I remember this year I chaired the session on World Condom Day, and it reminded me that almost 25 years ago, when I left Sierra Leone, I was in Geneva for almost 20 years, and I was a big champion of condom promotion, especially in my medical school days. I was happy that it has increased from 4.1% where I left it to almost 21% according to our current DHS, and which also speaks a lot to the other factors I may also later on highlight. And then also, some of the SRHR are at par or conflict with our traditional beliefs. But notwithstanding that, harmful traditional practices have actually reduced in our country, thanks to engagement from the government. And then also, another big issue is gender-based violence. During the war, it was even worse, and also a recent report from the COVID-19. But notwithstanding that, we have made a lot of significant progress in Sierra Leone, especially championed by the political will and from the office of the First Lady. Maybe you've heard about Hands Off Our Girls, which has really made significant progress. And then, from the health perspective, we've realized that we cannot do it alone. So we have really had cross-cutting issues and collaboration along ministries and other agencies, so that at least in a collective effort, we'll be able to really put in laws that are actually made sure that gender-based violence has significantly reduced. And then we always believe that together we can make things happen, true to the Africa context of the proverb that if you want to go fast, you go alone. But if you want to go far, you go as a team. So we very much believe that in Sierra Leone, especially in gender-based violence, where we cut across lots of the MDAs, the ministries, the developmental agencies, etc. And that has also helped significantly in reducing some indirect factors. Some of the outcomes of the gender-based violence, like the unwanted pregnancies, and wherein they fear they go to unsafe abortion places, which leads to maternal mortality among the kids, and all the women. That has significantly reduced. Many years ago, our maternal mortality was about more than 1,000 per 100,000, but we have been able to bring it down to 443, and the latest analysis shows that we are about 300 per 100,000 life births. So that is quite significant. It all speaks to the laws we have enacted in our country. And then we have also made significant progress in STIs, including HIV/AIDS. And then we continue to I've been in HIV/AIDS for 25 years before I came global. And we continue to make significant progress in that area, especially reaching out to the younger population that are the future leaders of tomorrow, which is why I like this topic. We are preparing for the tomorrow. So we're really targeting our youthful population to make sure that we have them to take over from us when we leave our planet. And in terms of gender empowerment laws, we have made quite a lot of progress, especially the Gender Equality and Empowerment Act for 2022, which is why, in Sierra Leone, we are so gender sensitive. I'm sure if people looking at this panel from Sierra Leone will be applauding us because we have 50% gender representation. And in Sierra Leone, it should be 30% minimum. You cannot have a panelist of all men or women without somebody raising the flag in the audience to make sure that we have that gender equality. I'm very happy that we have used gender sensitive in Sierra Leone, and it cuts across a lot of issues. And then also even in that area, we have the total inclusiveness that even when young girls going to school get pregnant, they are still allowed to continue to education without that discrimination, which was not the case many years ago. And we are very proud of that achievement, especially from a culture-sensitive country like Sierra Leone. And we have also enacted policies, and based on our good gains in maternal mortality and also our current focus on child care. I'm happy we have the program manager for child health and in this program, in this room. We have a lot of accelerated action on child care. And we are so ambitious that we are developing a safe motherhood and reproductive bill that really, when enacted, will actually bring added values to what we already gained in the area of sexual reproductive health rights. And that one is going to cause a lot of issues because most of the maternal mortality we saw before was in young, as I repeat myself, in young ladies who got pregnant out of desperation. They went behind the scene to regularize themselves, and in the end, they lose their lives. That is no longer the case. We are really giving them the options that safe abortion is possible, and if not, you can still continue education in university or so. You don't need to put your life in danger just because you want to regularize your future or fear from the community. So I think we have made a lot of progress in that respect, and I'm happy to share that little experience from Sierra Leone with you. I thank you.
Thank you very much, Deputy Minister, for your very interesting and wide-ranging comments. It's really good to hear about the progress you've made in Sierra Leone. Now, I'm going to ask my panellists a question, and being politicians, all of us, I know how difficult it is to stop talking and confine comments to be very small comments because we're professional talkers. So I am going to ask you all the same question. We're here to talk about SRHR into the future and the many challenges and opportunities that lie ahead. Could I ask you, each of you, in one sentence, describe the future for SRHR? We'll go to Secretary Becerra first. Just one sentence.
If the energy is there, the glass is only half full. We have seen how economic progress is made when both men and women have an opportunity to thrive. And so it can be positive, but it will take the kind of energy that we saw at 7:15 in the morning from this crowd to make that happen.
Thank you. Thank you very much. Minister?
The future of SRH. Yeah. I think the future of SRH is listening. It is empowering and digital health. Thank you.
Thank you very much. You've all been very good so far. So let's see if our final Deputy Minister, if you could rise to the challenge and discuss the future of SRHR in one sentence.
Yeah, I think the future for HRH is bright, But like we say in Africa, how you make your bed is how you lie on it. If we start planning effective today, we can have a sustainable SRH in the future. So the planning starts today and with you and me. Thank you.
Excellent, and that's a great note to end that discussion on. And I'd like to thank my three panellists. They've been excellent. They've given us some food for thought, and we really appreciate the time that you've spent with us. So I'd invite you to either take a seat in the audience, or I know you're both very busy, or you're all very busy, so you may need to leave us. But if you could stay with us for the discussion, we'd really appreciate it as well. So thank you very much. And I'm sure our audience is very happy with your participation here this morning. I'm going to introduce our four other panellists. They're going to come to the stage. We're moving on to an interesting way of running the next discussion. It's not something I've ever done before, but it's called unpaneling. So I'm going to step aside. I'm going to hand the moderation over to our four panelists, and I'll just briefly introduce them. We have Dr. Lusa de Toca, the Australian Ambassador for Health, Global Health and First Assistant Secretary. We have Dr. Pascal Attaloy, the Director of the WHO Department on Sexual and Reproductive Health. And we have Miss Lucy Fagan, the focal point for the major group for children and youth, and a leader with the PMNCH. If you could all just come to the top here, and we'll hand over to the unpanel. I'm looking forward to seeing how this works.
Okay. Hi everyone. Hard act to follow, especially for four committed and eminent politicians, but I'll try to do it with conganas. All right, I'm not going to do an intro because this is about the structure of the panel. Apparently I'm to pull a question from this bag. Which is slightly terrifying, but the best thing is that since I'm asking the first question, I don't get to do the first answer. So, all right. Looking back, it's important before we can look forward. What piece of evidence, policy, or program have you seen make a difference in advancing a more equitable approach to SRHR?
Me first?
Pascal, please.
Piece of evidence. Can I take three?
Absolutely.
Okay. I'll take. I think the single most important policy-related would be ICPD. It is the International Conference on Population and Development has been absolutely transformative in moving us from a population-based discussion about people to one that is rights-based and that has recognized women's rights and empowerment. While it was very focused at the time on population and development, it has had impacts across just about everything, whether it's education, whether it's health, and so on. So ICPD, I think, and it had the political push. And critically, it had a people movement. It was about the women's. I mean, it was in my lifetime. I'm that old, but I do actually remember when that it was a time that was possible for voices to be heard, for politicians to hear that voice, and for it to be picked up by the multilateral system and so on. So that's one. I would probably say maybe HIV, the HIV pandemic, and the availability of antiretrovirals has been transformative in bringing together the importance of looking at discrimination, stigmatization, and how we consider those as really important. I mean, we at the moment we talk about SRH being sensitive in issue as an issue to deal with, but some of the most conservative countries in Africa have picked up ARVs, which are supposed to be populations that were discriminated against, and they have access. And in the opportunities to extend antiretroviral therapy across populations, we have changed health systems to allow that to happen. So again, I'd take that as the second one. And I'll leave it there. I was asked for one. I'll take it.
Thanks, Pascal. Lucy?
I think it's really interesting, actually, because I was also going to say ICPD. And for me, ICPD is an agreement that was before I was born in 1994. But I think as someone who is a young person who is trying to navigate where my sexual and reproductive rights sit within my national policy frameworks, but also within the global space, I think ICPD continues to be this really cornerstone and kind of guiding set of principles and ideas that I keep going back to say, actually, this is about justice, this is about rights, and this is about choices. And for me, that's something really fundamental that I feel, you know, even as a youth advocate, it's really, really hard to try and progress, but to be able to say, actually, no, this is something that we already talked about, that we already agreed that civil society, feminist organizations, governments actually could come around. You know, we can't go back. We need to build on that. So I think from a policy perspective, that's something that continues to guide my advocacy. But I also wanted to talk a little bit about programs, because I think for me, and I guess coming and fully disclosing my own bias here in sort of youth SRHR, but I think, you know, really that adoption of youth-friendly health services has been really critical in terms of empowering young people to be able to access information, services, and care in a way that's non-stigmatizing, in a way that actually delivers the kind of care that they need, that's tailored to them, and also starts to build a more holistic view of young people's SRHR. So you're not just going for contraception, but you're going for a conversation around your mental health, you know, your family planning intentions, and really trying to take a more holistic view of young people's SRHR. And I think that's really powerful. And one of the things that really as youth movements as well, we have seen is, you know, with the advance of youth-friendly health services, policies and programs, has also been a recognition of young people as critical actors in shaping those services, so really bringing them into the process of co-design, allowing young people to say what is and isn't working, and really also, you know, young people coming to the forefront in accountability to say, you know, I've seen young people in countries from the UK, my own country, through to places like Ghana, actually developing scorecards, for example. How youth-friendly are your services? How much are they meeting your needs? And for me, that's really powerful, both a kind of a tailored approach to care, but also a co-produced approach to care. So for me, that's something that's really powerful and really effective.
Wonderful. We have a good spread of relationships with ICPD 30. I was 6, so I didn't go to Cairo. But it's hard not to mention that one. I at CPD 57 this month in New York. It's been a long month. We were having a side chat with colleagues and the ministers from Cambodia, from Laos, from Vietnam, and it was a very tangible example of how the program of action brought all of these discussions to mainstream. And I mean, different styles of government, but they embedded the program of action into the central planning so that every province was implementing, and it wasn't a side health issue or fringe issue. It was just a core tenet of the development program. In addition to that, if I may as well, for us, we've seen some of the advent of self-empowerment and breaking that barrier between service and person receiving the care or accessing the service or right. We often see that health workers are massive champions, but also can be a barrier in some places for people feeling comfortable, for people not being stigmatized. So online resources, direct care, medical termination via mail, even now related self-collection for cervical cancer screening have been fundamental. And refinum Pascal's point of HIV, pre-exposure prophylaxis, and what that means also for the choice to have children for people around the globe. So I quite like that in this context in which we are very worried about pushback, we're worried about the dying light, we're worrying about some of the loss of the rights and the advances that we take for granted. We have to look back and see how things have changed enormously in 30 years and the progress that we've made.
Wow, okay, so we are jumping straight ahead from the past to the future now. And much like the other panel were asked, we have the opportunity to reflect together on what are we most encouraged by when we envision the future of SRHR. So Lucas, I'm going to go to you first.
That's a hard one because we focus a lot on negative stuff at the moment with what's going on. But not to just be positive because you're here, but I think the way young people are leading this discussion, the way the conversations are happening now versus in the past, there's some negative and some concerning trends, and there was this recent publication on attitudes towards rights for women in different generations, and there's been some negative trends, social media, TikTok, all those things, the man rights activism of the world. But I think overall, even in the difference between me as a millennial and Gen Z now, the way people talk about relationships, the way people talk about consent, I wasn't out in high school, and now in many countries, many kids can be. I think it's quite encouraging, and if we make sure that people who are in positions in power at the moment provide the space for the next generation to take over, I think we're in good hands. We can talk about technology later, pros and cons, AI, scary, but also opportunities. But I'm very encouraged by the attitudes all around the world that young people have towards these issues.
Pascal, over to you.
You're talking about Gen Z and millennial made me remember when we were putting this, organizing this, it was an intergenerational discussion, and I think for the first time I'm the grandma. This is a new thing for me. But I think I'm
the dean, not the grandma.
I am really encouraged by the youth voice and the youth movement. I think that they are a lot of the voice comes out of concern about the future, which is very legitimate concerns. But and I know that we're not doing enough of it. But I think that there are a lot more spaces for young people to engage. How that informs, and it is our obligation to listen. I think we are trying to do that much better, and in doing that, in terms of how it informs our work, it is part of the reason that we're trying to take a much more futures-oriented approach to the work that we do. Just understanding, for instance, the technologies. I know you want to leave that till a little bit later, but the technologies available that allow for information flows to be better, both for our listening and for our creation or development of the sorts of technologies that will be useful for the future. The other thing that I do want to raise as well is almost every time I talk on a panel, people say, but you talk about women, what about the men? I think we are we are at a space now. I think we started this work very much as women's empowerment, recognizing the equity-related issues. We are not there yet, by far. I mean, it is heart-wrenching that we're still having to try and promote women's equality today. Nonetheless, it is also important that we recognize that as we're talking about sexual health, it is not just about a single person. It is about our bodies, but it is about how we choose to share those bodies with others, and it is relational. So I do think that I'm encouraged by a lot of the discussion that is now available. We're talking within our department about the poor options. We complain about men not taking responsibility for contraception, but actually they have the condom and they have sterilization. We haven't done much in those technologies, so we do have to think about really what it is like to bring others into the discussion and the way that we think. And I think there is a much more openness to being able to do that.
Great, thank you. Well, always good to hear 2 votes for youth here. I was just reflecting back, so about a month ago, I was in Cotonou for the ICPD Youth Dialogue, and when I think about what encourages me and what inspires me, I kind of think of that moment, because actually 400 young people from really diverse countries, contexts, realities coming together with some really shared messaging and some bold and decisive passion for the future. I think you're right in saying that actually from the pushback has come a stronger movement, and that's really exciting. Young people have seen their rights being threatened and being eroded, and instead of feeling frustrated, they've really begun to translate that into action. There's so much happening on the ground that young people and youth movements are leading. And in those couple of days we were together in Benin, conversations happened around positive masculinities, around how young people can really mobilize against anti-gender and anti-rights movements, how we negotiate consent, how we navigate online worlds where, we have access to a lot more information and to services, which is fantastic, but also we see the proliferation of misinformation. We see online violence against advocates, and how we as the next generation are really navigating some of those conversations. And to look outside of youth for a moment, I think the other thing that really inspires me in this space is the intergenerational solidarity. So there is the bridging between movements. It's not just young people, it's not just our deans, it is actually the power that we share with each other, the knowledge we share, and the strategies. We're not in this game alone, right? We're here to support each other. And I think that kind of solidarity, that kind of movement building is an inspiration for me. When I look to the future, we might see pushback and rollback, but we're strong, we're together, and somehow we're going to make it through. So definitely inspiring for me.
Slightly terrifying process.
If I don't like the question, I'll change it.
We own the panel. You can do whatever you want.
We didn't see it, you can go back.
Okay. Looking ahead, how are you working to advance comprehensive sexual and reproductive health and rights in your community or organization in light of new global challenges?
Whew, okay. So I think, just speaking from the youth movement and sort of youth-led organizations in the SRHR space, we're taking a number of strategies. So I think as we see global pushback and even national level pushback, we're really trying to invest our efforts at community level. So, really empowering young people with information and capacity to be able to navigate their rights, drawing out the evidence on what's working locally and the kind of relationships it takes to actually ensure that young people are able to realize their full range of SRHR. And then really trying to build a bottom-up approach. So thinking about, okay, maybe in the national context, we're seeing pushback against certain things. How do we, really try and build some solidarity, build some evidence, build those new relationships to make sure that we can demonstrate what works and bring that evidence back up. But then I think at the global level, we're really also trying to be a little bit future focused. So we're thinking, what are the challenges we're seeing coming down the line? For example, threats against access to safe and legal abortion, and how are we really building our strategies around that from the sort of national to the regional to the global level to make sure whether it's, seeing our bodily autonomy directly under threat, or whether it's sustaining the progress that's been made, making sure that legislation equals implementation, and that actually when we see those threats that we're really responding to them. I think the other thing that we are really trying to do in this space is, again, thinking about digital spaces, really trying to harness digital to kind of circumnavigate some of the challenges we're seeing. So, for example, in the UK, we're seeing strong pushback against CSC, and we're not the only country by any means. How are we, as youth-led organizations, using online spaces to share information and make sure that young people continue to have access to evidence-based, high-quality information about their bodies? And then trying to actually engage outside of the kind of SRHR focused space, thinking about how we're engaging in policy conversations around digital regulation, how we're engaging in conversations around economic justice and what this means for our access to health and to SRHR. And so I think we're really trying to move with the times a little bit, but also look to the future and think, what are the threats that are coming through? How do we protect the gains that we've made? And how do we continue to sustain the movement? And I think I would be failing the youth movement if I didn't mention as well, we are really seeing a lot of restrictions on financing to community-led and youth-led organizations, which really does influence our ability to do our work, particularly when we think about community-led service delivery, peer education, and those kind of advocacy work that we also need to be doing. So I think the other thing that we're really trying to do is try and think about how we can bring money into these spaces again to really make sure that from the grassroots we're being resourced to do the work that really makes an impact regardless of what's happening in these policy spaces. And that's something that I think we need to talk more about, and I think there is the need to kind of come together and really think about how do we ensure that from the grassroots people are really being able to and resourced to do the work that counts regardless of what's happening in the policy spaces, no matter what's happening in terms of push back against abortion or CSC. Really, the work that continues on the ground is what counts. So how can we make sure that people are able to do that? Thank you.
Thank you. That's comprehensive. I don't know if I can add, but from our perspective, of course, we still have a lot of work to do at home nationally. A Minister for Women, who's also a Minister for Finance, launched our first gender equality strategy a couple of months ago. And we're committed to increase access, for instance, to universal free safe abortions, which is not available for all women in Australia at the moment, but it is getting better. We have the first government with majority women and the first cabinet that is 50-50. So we still have a long way to go, but there's strong national commitment. We have a strong focus regionally, and of course there's the funding element of it. We are the biggest funders of SRHR programs in the Pacific with Transformative Agenda, and in Southeast Asia with CSURGE. But now we're including, under a new international development policy, more innovative approaches to support civil society organizations and a quality fund that is about grassroots support and working in a different way that acknowledges the role that Australia has had in the region as a high-income country, as a country involved in colonial history, and what we bring to that table, not as neutral Western blank observers, but as a country that has a shared, not always great, history with our region. So much more listening, understanding that solutions look very different, and that what we see in the surface as potentially a more conservative society, more conservative governments, actually a lot is happening. It's if done the right way and led by community members, and we are pivoting how our development assistance program is so that it can respond to those, which often requires less traditional forms of engagement, but we're seeing massive progress in our region, led by community members in all of those countries in the Pacific and Southeast Asia, and that's what we are committed to continuing.
How much time do we have? 1 minute? 1 minute. Okay. Oh, okay. Okay, so I will have my interventions and use them as a wrap-up as well. I think primarily one of the things that, obviously within the context of the department in WHO, continuing our normative work, but critically looking at how we can enhance how we work, think about intersectionality, inclusivity, and the universality of human rights. So how do we enhance the work that we do, really putting people first? Recognizing that into the future we are evolving as a society, and therefore how we think about different groups and marginalizing factors are changing as well. We have to think about how to be much more inclusive. We have to look at health systems and how those are changing as well, recognizing again that we are in, unfortunately, increasingly conflict-ridden situations, and climate and humanitarian situations. We have to look at our health systems and how we can integrate better within health systems. Again, also recognizing that it's not always government-led. So how do we bring the health sector in? How do we bring other forms of health service provision, self-care, and so on? Technologies we didn't talk about. We tend to talk about AI as something separate. it's in our lives now. So across the board with everything we do, whether it's about information, whether it's about telehealth and so on, how do we integrate these, not to be as scared as we seem to be, but integrated across the board in how we think about the work that we do. And I'll hand back to you now. You're looking very, very scary.
Thank you very much. That has been fantastic. I've never experienced a non-panel, but that went really, really well, and that's down to the quality of our panelists here. And I'd like to thank each of you for your time, your contributions, and the really interesting discussion and your expertise. I think it's informed a lot of the discussions that will take place over the coming few days around the World Health Assembly. So thank you very much for your time. Ladies and gentlemen, thank you very much for your time, and the future holds immense promise for SRHR. As this discussion today has made clear, the road ahead for SRHR may be complicated, but it holds immense promise. It is essential that we continue to come together across our generations, cultures, geographies and mandates to ensure SRHR is not relegated to the margins of healthcare, but recognised as critical for the overall well-being of individuals and the communities in which they live. This event has been the next step in a discussion about the future of SRHR. Look out for a report from the WHO and the HRP on this, and it's coming very soon. I wish you all a productive week ahead at the World Health Assembly, and I look forward to continuing the discussion outside of these four walls. And I'd ask you to look out for our podcast as well. And the very first episode, we have Pascal as a guest. So it's obviously excellent, and I'm presenting it. So, so spread it among your networks and your contacts and parliamentarians in your country, because that's what it's there to inform the discussion in our countries. Before concluding, I would like to mention that the IPU and the WHO are organising a parliamentary dialogue on Wednesday at 5:30, that's tomorrow, in the Palais des Nations, to delve more into the role of parliamentarians in moving the global health agenda forward, and that's open to all WHA delegates. And thank you again for joining us, and I hope you will stay and enjoy the refreshments and enjoy the week. Gurmagad.